So, good afternoon and a very warm welcome to all of you present here today for the fourth episode of Inside Implementation. The Inside Implementation webinar series is part of a 5-year project called Anushtana, which aims to understand the implementation of tobacco control policies in India. This project is supported by the Department of Biotechnology, Wellcome Trust India Alliance, and is conducted at the Institute of Public Health in Bangalore. Previously, as part of the Inside Implementation webinar series, we've organized 3 episodes, one on different tobacco control strategies for youth, one on implementing the ban on tobacco control advertising, advertisements, promotion, and marketing, also known as TAPs, and one on on-ground experiences while banning public smoking. Today, we'll be discussing the role of civil society organizations and the strategies they use in implementing tobacco control policies in India. Civil society, as we all know, has played an important role both globally as well as in India. They have been at the forefront of anti-tobacco control efforts, both at the policy-making level, where they have helped influence the development and amendment of anti-tobacco control laws, as well as at the implementation level through advocacy, training, capacity building, and awareness. In this episode, we have tobacco control advocates from 3 civil society organizations joining us today. Our first speaker for today is Dr. Ashima Sarin. Dr. Ashima is the director of Sambandh Health Foundation. She is also the director of the Voice of Tobacco Victims, VOTV campaign, which built up into a network of over 450 plus eminent doctors who are volunteering on tobacco control agenda across India. She has helped develop new implementation models in tobacco control and has made noteworthy contributions in the development of tobacco control policy in the country, which has led to reduction in tobacco prevalence in India. She's also been a part of major advocacy campaigns leading to the enactment of 2 national acts at various policy changes at the national and state level. Dr. Ashima Sarin is qualified with a PhD in public health, an MPhil and Masters in Public Health from the UK, an MBA from Pune, and an MA in Sociology from Punjab University. She has 15 years of experience in tobacco control and has been trained under the Tobacco Control Leadership Program from the Johns Hopkins University Bloomberg School of Public Health. As she is unavailable today, she has sent a recording of the video of her presentation. So I request Kumaran to play the recording.
So very good afternoon, everyone. First of all, I would like to thank IPH for inviting Sambandh to give us this opportunity to talk about this webinar about the implementation of tobacco control laws and many other things. Now, in Sambandh Health Foundation, we have 2 areas, one in tobacco control. One is we work on the policy side, and the second is implementing those policies. In the policy changes which we work are under the banner, this Voice of Tobacco Victims. It's a very popular campaign, and I'm sure most of you will be aware of it. And the other one is run under, implementation campaigns are run under Pledge for Life. So under Pledge, see, at Sambandh, we believe that policies, they are very important. That's the first step. But these are pieces of papers unless they are implemented. So implementation is extremely important. Now in implementation, we have first is tobacco-free educational institutions, and then laws, tobacco control laws, enforcement of these, and community mobilization. So these are three areas under these 2 campaigns which we run at Sambandh Health Foundation. Now, we have a very strong belief that prevention is better than cure, and all our campaigns are based on this. Now, how do we stop the initiation? See, one is making the campuses safe for children, making sure there are activities which they participate in, then having police, which is basically stopping the access to tobacco, and there is community mobilization, wherein the community is talking about tobacco control. And heart of that is Voice VOTV campaign. This is heart of all our campaigns run at Sambandh Health Foundation. Now, like I said, first I will share about VOTV, what it is, and then our campaigns. One is Voice of Tobacco Victims. These are the policy changes, as I shared, that VOTV, under VOTV, we've got policy changes. 44 VAT, and this was pre-GST, when we had 44 VAT tax increases in 20 states, Gutka and twin packet ban, this was purely our baby. Loose cigarettes were banned under Legal Metrology Act. There was an amendment in JJ Act in section 77. Then pictorial significant contribution by Voice of Tobacco Victims and the doctors in pictorial pack warnings. You all must be aware of this particular policy. And recent electronic cigarettes ban. Now, Professor Pankaj Chaturvedi, who is the director in Tata Memorial Hospital, Mr. Sanjay Seth, who is the trustee here, and myself, with 450 plus doctors, these doctors are volunteering their time. These doctors are across India and volunteering their time because they believe in prevention and this is going to yield more results. So first part is done, that is what policies were brought in India. Of course, there are other civil society were involved in other impact warnings, e-cigarettes, etc. Now, talking about making the campuses safe. So TOFI implementation by Sambandh. Currently, we are in 4 states: Uttar Pradesh, Meghalaya, Karnataka, and Andhra. We started this TOFI campaign, implementation of TOFI under Pledge for Life. We started in June 2020 in 3 states. That is Uttar Pradesh, Andhra, and Karnataka. And Meghalaya, we started March 2021. Now, till now, in all these 4 states, more than 1.9 lakh schools together have done more than 4.7 lakh on-ground activities. So if we talk about state-wise, right, Uttar Pradesh, it's like a country. We have more than 89,000 schools have done 1.7 lakh activities, more than that. Meghalaya, as I told you, we started only last year in March. More than 10,000 schools have done 4.46,000 activities. So these activities are all on-ground activities which these schools are doing. Then we have in Karnataka, where IPH is, 49,400 schools have done more than 1.4 lakh activities. Similarly, in Andhra Pradesh, 44,300 schools have done more than 1.1 lakh activities. So on an average, and also in all these states, 100% of the districts are active. They are implementing. When I say active, it means schools have done at least one activity. Unlike in Karnataka, it is on an average is 2.6 activities per school. So this is about making campus safe, having the activities wherein students are participating. So that is TOFI implementation in these 4 states. Second, I talked about is how to prevent initiation, is making sure the access to tobacco there's no access. We need to make sure the laws are enforced for that. And we have worked in various states, including Karnataka, and our model accounts for more than 70% of enforcement in the country. So how we got it done is it's totally another story. I don't have so much time, so I will just talk about that. This is the success when we worked in various states. And then there is community mobilization, which is the last part, which will reduce the prevalence. So we worked with the National Service Scheme, NSS. In these 8 states, there are various on-ground activities by these NSS volunteers. If you see, there are pledge, there are poster competitions, there are street plays being done by them. So there are 2.7 lakh NSS volunteers participated in community mobilization activities. Of course, during pandemic, we had Spit Free India movement that was also very popular. And we basically developed an app, and more than 7 lakh responses were registered on the app. And if you talk about the views, there were more than 40 lakh views on the app. So that is what we done at someone. Mix first is getting policy changes and then implementing those policies. So that's all from me, and I will have my colleagues Mohammad Amir Khan and Aarti Gupta also with me to answer questions if you have any. Thank you so much.
Thank you, Dr. Ashima. Our second speaker for today is Mr. Binoy Matthew. Binoy has been working as a program manager, communications at the Voluntary Health Association of India, VHAI. As a public health and communications professional, Binoy has over 13 years of experience in developing and implementing strategic communications programs, media management, advocacy, public relations, media liaisoning, communications, research, writing, and editing reports. At VHAI, his role is to develop and implement communication strategies at the national and state level, as well as provide technical guidance to state partners, networking with important stakeholders, and develop and maintain linkages with the national level. Binoy holds a master's degree in mass communication and a certificate course on communications from Johns Hopkins Bloomberg School of Public Health in the USA. He also holds a certificate from BBC from training and capacity building in the area of media advocacy in order to build capacities in handling media advocacy issues. He represented VHAI at many international platforms and have presented papers at various international conferences. He's also received the Meritorious Service Award from VHAI in 2012. Over to you, Binoy.
Thank you, Vivek, for the introduction. Good afternoon, everyone. I'm Binoy Matthew. I work as a program manager with Voluntary Health Association of India. First of all, I would like to thank the IPH team for inviting VHAI to be part of this meeting. So this is a very important topic, and we have all been working on about the tobacco control, and the civil society role has been very crucial, and how civil society has been working very closely with the government of India in promoting and also educating the masses to in the reduction of tobacco use. So next, please. So about VHAI, Voluntary Health Association of India, it's a non-profit organization, national organization. It's been we've been working for the last over 4 decades. We have a state chapter office in around 24 states, and over 45 member institutions are being associated, and also over 1 lakh grassroots level workers have been working with us. And we have been one of the pioneers in tobacco control, both at the national and state level, due to our presence in 24 states, VHS. And also we've been working very closely with the government of India, and we've been part of many committees of government have been set up. VHA has been part of that. Next, please. So our main key focus area in tobacco control is primarily we've been focusing on coalition building and networking. We've been trying to establish the national and state level resource center. We have a very comprehensive law, as you all know, that Cigarettes and Other Tobacco Products Act. So we've been working very closely with the government of India, both at the central and also at the state level, for the effective implementation of COTPA, and also to create, the comprehensive smoke-free environment. In the initial phase during 2009 and till 2013, we've been focusing in around 9 to 10 states, whereby we were working very closely with our state chapters and also with the state government for the effective implementation of COTPA. And now recently we've been working in 2 focus states, that is Telangana and Uttar Pradesh. And also, we also focus on the monitoring and reporting of violations, because yes, of course, we have a very comprehensive law, but yes, of course, how the law has been violated. So how to report to the enforcement authorities? So we keep on monitoring that also and keep on doing that. The other aspect is the alternative livelihoods, like mainly for these BD workers. So we've been we are one of the organizations which have been working for this, had worked in the past towards how to create livelihoods for these BD workers, and for this we have been working with Ministry of Labor and Employment as well. Next, please. So my the role, it's very important, two focus area that VHI has been primarily focusing on over the period of time. This has been one of the important aspects that we have been working, because since it's a national organization, and these two aspects have been very important in our work. So one is political and policy advocacy, which we've been using it very comprehensively. And these are our, a basic, a strategy, or I would say a framework whereby we've been working very closely. And we have seen, adopting this framework, we have been able to, contribute. I would say we've been able to contribute along with other partners, and, who've been working, in the country. We have been also been part of many important policy, things. So what we actually do in this framework, like, for example, we have we first of all try to set up an policy objectives, that what we want to achieve, what we want to do, say, for example, if we are working for pictorial health warnings on tobacco products, or to increase tobacco taxation on tobacco products, or to have a smoke-free, a city. So first we have to set up a policy objectives, and thereafter setting up the policy objectives, we then map the stakeholders. Like, in health, these are the important key people who have to be, approached for, or whether in the Ministry of Finance, whether in the Ministry of Labor, So main key, who are the key people. So we do all that mapping stakeholders along with the coordinates and all that. And then after collecting the coordinates, we do a background check, whether the person is in support or again, or, how to understand the political landscape also, how that person is going to help us, or how the person is going to support us in our ongoing work. And then thereafter, once this it has been prepared, then we we need to prepare, evidence base. As you all know, that when you are going to a policymaker, or when you are going to any stakeholders, you need to go with a ready-made, fact sheet, what you are trying to take, what are the key asks. So we do collect all the credible data and information, and then thereafter drafting the representations, and then showcasing also some best practice, like, if, say, for example, if something, good has happened in Karnataka, like, if the police department is doing a good work, so taking that cue from them, and then, we can take it to other state. So similarly is that that also we try to collect all that. And then thereafter, after this second round, what happened, we are ready with this policy. Then we have to go and meet the, to sensitize the policy makers, whether in the health, education, finance, wherever. We need to sensitize the key policy makers who have been sharing with them the policy briefs, and also, sensitizing them. Sensitizing is very important. Why it is important, that the policy asks, which we are trying to do, and why it is important. There is a need of sensitizing that also, so that we keep on doing it. And it's not like one time go. You need to keep a regular engagement with them. It's not like, a first time you go and meet them, you share the representation or a policy brief, and thereafter don't know. Yeah, you need to keep a regular engagement, try to share with them on a regular basis, so that, the policymaker, whoever you are going to meet them, so get sensitized and also supports you that. And the fourth thing is that you need to create, we have create champions that we have been doing. There are few champions, like, not only the policymakers, like if you have, some of the member of parliaments, you have some of the member of legislative assembly, MLAs, these are some of the, MPs, MLAs who can help you, in getting, how the parliament session happens. So these MPs, raise the questions on important tobacco control issues in the House of the Parliament. So there also we keep on engaging with them, we share with them, so that, they get motivated, and then creating a champions, because if you have champions, then definitely they will help you out. And if you create a network of champions, then they will help you, in taking your tobacco control agenda at the highest level. So this is a framework which we are been following at app and keep on adding it, and we have seen, this is definitely helped. Of course, you need to work very closely with the government, because you as a civil society, we are supporting the government of India's work on tobacco control. So this is how we do at the policy level. Next, please. So these are some of the glimpses that you can see, which we have been engaging with important policymaker, whether it is the health ministers or whether it is MP, or engaging, like as the previous Dr. Ashima was telling about the voice of tobacco victims at the campaign that someone has initiated. So this one photograph, if you can see the Sushma Swaraj interacting with this was long time in the year 2012, when when everyone, like civil society as an whole, where we're trying to if government of India can ban gutka. So a network of it's like you need to create different voices. It's not only like only civil society, but of course there are voices from different sources have to come for while we are working for tobacco control. So this was one of the voices, like all the cancer patients came together on our platform, and they urged the government of India that they should ban gutka. So this is one of the things where Sushma Swaraj has been interacting with the corporations. On the left side, you can see that former health minister Dr. Harshvardhan flagging off a rally during the World No Tobacco Day in 2014. That was a theme on increasing tobacco tax. So here you can see school students in Delhi, they are urging that government should increase tobacco tax. So thereby this is how the engagement is there, and how togetherly, collaboratively we've been trying to do that. And similarly in this thing, the health minister of Kerala releasing the GATS fact sheet of 2016, and then hereby we are been sensitizing the police officials on the COTPA implementation and enforcement. So these are some of the examples. Next, please. Yeah, so this is like as I shared it in my previous this thing, we keep on not only at the center level, we keep on provide technical support to the state government in their implementation and enforcement, because how it is, government, of course, the needs support from the NGOs and civil society in taking up the program. So we do that both at the national, state and district level. We provide technical support for enforcement, like for example, state tobacco control cell, like in Uttar Pradesh, they say ki, we want to organize some sensitization thing for police official, or for the medical institutions, how they can take it up. So there we go there, we organize that. So, or developing some IC materials, because many of them, they are not technically sounded, but definitely they need some technical help also in developing these IC materials, which can further be used for their work. So we help them in developing that. In that scenario, we don't take normally organization take the credit, but we definitely we don't take any credit. We provide all the support from outside, so that the program is going on very well. Media, of course, definitely lot of time there's a lot of good work is being done on tobacco control, but somehow it's it does not appear in the media, because media is very important, because it actually educate the people, generate awareness. So media, you need media, and we have been using comprehensively that way. And then knowledge sharing, community engagement, we keep on doing. So some of the policy important issues that we worked on: pictorial health warnings, tax increase, tabs, smoke free, tobacco free educations. So to give for the a national policy issue, you need to give a state level support. It's not that state level support is also required for the supporting the national level issues also. So this is like we have been able to create a partnership. As I said, it's together and with the collaboration of everyone, definitely we will achieve the our goal. And throughout this our journey, over the period of 10-12 years, what we have tried to see, and what we have actually have seen, that things have really changed, and with the collaboration of everyone. So we've been using all these things like, doctors, health professionals from across all the, states who have been helping us in our work. Like, in Karnataka, Dr. Vishal Rao has been really supporting us, whenever we need something, likewise. Similarly, civil society, academic education institutions, parent teacher association, youth, students, again, it's very important because the government is right now youth centric. So you need to mobilize them. We need to create more voices, and again, lawyers. Then your people representancy means your member of parliaments, MPs. They are also one of the, our representatives who can help us in our tobacco control work. And then lastly, but not the least, media, it's very important in our work. Next, please. So there has been many positive developments that we have seen over the period of time, and I'm really happy to see, and that while when the momentum was created long time in tobacco control, when we know when the law came in, when the COTPA law came in 2003, and over the period of time, things have really really changed, and this is we should take this thing with the support of all the civil society organizations who have been working in India, have played a crucial, and not least government of India has played a very crucial role, and that is why we have some very important policy goal that we have been able to achieve, like the 85% pictorial health warnings on all tobacco products, both front and back. Then of course we have also set up a very best practice this thing in the world, that we have a statutory warning that has been displayed in the films also. This is also another remarkable development that has happened in India. Next, please. Some of the very important which we have noticed in in 2019, when government of India has really taken up this thing issue, because it was been really a very crucial, and it was been gaining very popularity among the youngsters. So government of India has really took a stand on this, and of course civil society was supporting outside this thing, how we been able to generate awareness, and likewise government of India banned the electronic cigarettes. Then we have the ban on gutka under the Food Safety Standard Authority. Again, this is also the efforts of the civil society organizations who have been working in India. Through them, gutka has been banned under that FSCI. Then we have been working towards tobacco-free education institutions. Yes, of course, tobacco products is being taxed under the highest GST merit under 28%. This is also again a very remarkable thing that has happened in India. Vendor licensing policy, yes, few of the states have already initiated it. The Ministry of Health, as you know, Ministry of Health has issued an advisory law in 2017 to all the states that, non-tobacco products should not be sold along with tobacco products. So few states have now taken it up, and some of them have been implementing in India now the licensing policy. Next, please. Yes, now the next component which we have been using, and this is our core strength, I've been working on this thing. So media is very important in tobacco control. And of course, as I said that, in order to support the policy work, media advocacy is also very important, because they shape play a key role, in shaping knowledge, and also generate awareness, educate the masses, and also reaching out our message to the decision makers. So we've been keeping a regular sensitization and engagement of journalists from national and the state level to keep the news, to keep the tobacco control in the news. And we have a network of journalists, both at the national level and the states which we have been working. We keep on, every month we have been doing stories on tobacco control, and we've been doing that. So this has been really a game changer, I would say, that in terms of providing visibility. And this is all earned media thing that we have been doing, because to your knowledge, there are two types of media. One is earned media and paid media. Earned media is that when you provide the information, when you share something, or when you share a press note, or when you share an order with them, and then the journalists publicize the story, that is called the earned media. And the paid media is that, you are paying something to the media houses or to the journalists to publicize the story. So in India, as per the FCRA rules, you can't pay money to the media for this. There's a clear violation. So VHI has been working completely entirely on the earned media part, and the media has really supported us in the tobacco control. Next, please. So again, we have a framework as we have adopted for the policy. This thing, we have a framework for media advocacy as well. So we have been, we did the media mapping. Like for example, there is a concerned journalist who been, like for example, in Times of India, the journalist is there, correspondent who been looking after the health entirely after the health issues, or the journalists who have been covering entirely after the finance issues. So we do the media mapping of the journalists, we collect the coordinates and all that, their names, telephone numbers and everything, and then then we try to sensitize and educate the media. So we provide them timely, accurate information. We draft the press release which have the codes, background materials. We also use them on important days, like yesterday only no smoking day was there, March 9. So we utilize that, and we have shared this release with them, like the doctors, cancer victims urging the government to to implement COTPA amendments. So that we've been using that. Communication channels, of course, we've been using the print media, electronic, online, and social media. Now we have been using it also. So we keep on doing that, and then of course build relation and champions. Again, as I said that it's not a one-time thing. You need to build a relationship and with the journalists, so that they supports you, because they are a very good they are a good source of information. Many times what happens that you are sitting outside, but they are connected to everyone. They know what is happening in the government and all that. So once you make a relationship, a good network with them, they will also provide you all the support in that. So we have seen this over the period of time. It was not that just now we have been working with the media for the last 11-12 years. Have been working very closely with them, and we have been able to build relation with them, and they've been very helpful, and they have been supporting us in tobacco control. And of course, due to the media, there has been a game changer. Things have really actually were not happening, that they have they have created a big thing in that. Next, please. So of course, you all have been also been working with the media, and your team have been doing it. But yes, of course, how we can provide support to the media, because journalists don't have too much time. They don't get out to do. So of course, you need to assist them in accessing the resources. You have to help them with reference material, facts, evidence, and photographs. It would be really good that you develop a story idea, like something is happening in that. We have been doing that in consultation with the journalists, what they think also. It's not that you are giving a story they should publicize. No, sometimes you need to talk to them. You need to know what they think, that this is the angle, what you think, and then thereafter making a story package. As I said, they don't have too much time, so it's very important to prepare a good press release which is factually correct, and then it can be brief, concise. It should have all the quotes and all that in the press release, and then the journalists don't have to check further, and then they can write the story. And then of course your website, you are connecting to your website, so your website also should have all the information. So if there's something they want to know, they can connect to your website and then can get the access to that. Next, please. So these are communication channels, which you all know, that newspapers are there, TV channels, wire agencies, broadcast, social media now has become, we have seen during the COVID pandemic, social media has really emerged as an important thing. And it has been, and government, everyone has been there on social media, and how we can, take it up, how we can use them in our tobacco control work. It's very now. Next, please. Again, like as we say that how we used it for policy level, similarly, you need messengers for media. It can't be that only the civil society has been giving the quote to the media, because normally, you need a different voice. So we have been working with these different voices, and have been able to create a network whereby whenever we give some stories, we think that, like, for example, if we are giving a story for National Youth Day, so you need a youth representative who's giving the quote. So this is some of the voices that we have created. Maybe there may be a different voices in your state specific as well. But yes, these are some of these doctors. Previous slide, please. Yeah, so you have doctors, civil society, academician, journalist, activist, public health groups, experts, social media use. So these are some of the, and of course, it's not like all these voices should be credible. They should have a voice in the media. It's not like, some unknown people, some unknown doctor, like, Dr. Vishal is a very known doctor, not only in the national media, also in the in your Karnataka media as well. So somewhere, some person like that, we need to have them, like, like Dr. Pankaj Chaturvedi, who's an oncologist in Tata Memorial Hospital, like that base. So similarly, we have been working with different voices, and they've all been helping us in our media related work as well. Next, please. So these are the outcomes, and these are all earned media related stories. We have been able to sensitize the media. We have been able to create public awareness, mobilize the public opinion on specific tobacco control issues. Also, we have monitor and track industry tactics. Many times the industry also, how industry mislead the people by, giving wrong messages in the media, that also we do that. And also you need to deliver the right messages to policymakers. This is very important. Next, please. So these are some of the, media story articles. These are all earned media stories. And just want to share a number. We have been able to generate over 10,000 earned media stories from the period 2011 till now. So these are some of the issues that we had worked very closely, and on different issues, whether it is on tobacco tax, or whether it is gutka ban, or urging the government to include BDs in the GST. All that we've been doing that. Next, please. Yes, this is a challenge in our efforts that we all are working on, and and these are some of the challenge in the advocacy efforts, what we all are been doing as a whole. But of course, there is constant pressure by the industry, to how they are being pressurizing the government. And we have seen in the past, and now also they have been doing it. Like, when the pictorial health, 85% pictorial health warnings was about to come, they were actually, pressurizing not to implement. And then they create misleading facts. They try to create groups, different groups, like, if this, and they are always against that. If any law is coming up, if any policy goal is coming up, that is going to affect the livelihood. So this is their always a repeated argument that they keep on doing it. And then they try to bring all these BD workers to basically see, and also they run media campaign also. These are some of the, the advertisement, from New Delhi. I'm just showing it to you there. During the, the pictorial health warning and taxation, this thing, they've been pasting it on auto rickshaw, this one person saying that don't protect our livelihood, millions of tobacco farmers like me, don't terrorize my customer. So they keep on doing all this, this thing to basically mislead the government and also put pressure to the government. Next, please. So how we can counter them? We need to keep a constant watch what the industry has been doing, and of course we need to counter them timely, because we should not, like, they should give misleading information to the government or to the media. So very important, we should counter them, and then getting support from economists or doctors, health professions, consumer groups to counter their arguments which being put by the industry. Next, please. So these are some of the learnings, which we have learned over the period of time, and we keep on learning. Is always a process. We keep on learning all that, and definitely we try to work towards it to achieve it and to monitor the new developments time and time. It's very important. Like, we all have been working in tobacco control, so we need to keep a tab of all the developments, what is going both at the central and state level, which we are doing. Regular sensitization is very important. Regular engagement with is very important. It's not like one time go that we go and meet and then just, it's not that. We need to keep a regular engagement, and then trying to create more and more voices. It's very important. More and more voices is important for our tobacco control work, to engage with different groups, to engage with different stakeholders. It's very important. Then only we will be able to achieve our goal. Thank you so much for listening. And if you have any questions, I will be happy to answer you maybe at the end of the session. Thank you so much.
Thank you, Binoy, for sharing your valuable insights into what VHAI does, not just at the policy making, but at the implementation level, especially in terms of being prepared well in advance, conducting stakeholder and media mapping, and sort of bringing together different groups under one umbrella to work towards tobacco control. So inter-stakeholder coordination, as well as fostering national and state level partnerships. We now move on to the third and final speaker of today's webinar, Mr. Achyuta Nagaragadde. Mr. Achyuta is the Program Officer of the Tobacco Free Education Institution, TOFI. He has been working in tobacco control for nearly 9 years now. And during this time, he has worked with several team members as well as on individual capacity in organizing various events, programs, delegation visits, trainings, etc. He is in close coordination with the member of the High Power Committee for Tobacco Control in Karnataka and helps in supporting the government system in implementation, reporting, and reviewing of tobacco control laws in the state. This coordination requires communication and coordination with state health authorities like health, home, education, urban development, and several other departments. So Achyuta is helping in RAPO, in RAPO and sort of coordination with different agencies, both at the state, district level, with different unions such as street vendors, Bar and Rest Association, Teachers Association, Private Schools Association, etc., and also NGOs as well. For this webinar, Achyuta will be talking about his experience in implementing the TOFI project in Karnataka, as well as COTPA implementation in the state. Over to you.
Thank you, Vivek. Thank you, everybody, for this opportunity to address the experience of IPH in tobacco control, particularly in the state of Karnataka. So yes, IPH has been, it was started in 2005, and it has been almost now 16 years since it's working, and works on 4 major areas, primarily chronic conditions and public policies, health equity, health financing, and health services. So these are the 4 areas where IPH work, and tobacco control is one realm where IPH has been working on both research as well as action. So I'm kind of taking you across the action part, on how IPH has constantly engaged with the key government officials or key government agencies in various aspects. So these are some of the few points or few agendas where IPH has been able to engage with the public representatives for key policy decisions and implementation. So one, I think, major major milestone is COTPA being included in NCR, and COTPA as part of NIC. I think probably Karnataka was one of the very first states to have these two incorporated, and tobacco control as one of the agendas in VHNSC. That is Village Health and Sanitation Committee, and also probably the very first few states where PDOs, the Panchayat Development Officers, are empowered to implement COTPA. And I think COTPA High Compliance District model was something that was initiated in the state. So I think IPH was, it's glad to say that IPH was the part of that process as well, and of course the TOFI implementation in one district that was done last year. Okay, so what is COTPA compliant district? So basically, we work closely with the district authorities, mainly the DC, SP, the DHO, etc., who are the district level authorities for implementation of COTPA. And we realize that we need to use both the top down and the grassroots level approach for tobacco control. See, because usually what happens if we directly go to the implementing officers, like maybe like police inspector or PSI or health inspectors, they may deny implementing because they may say that they don't have any necessary orders. So we work first at the highest level of policy implementation, like IS, IPS officers to issue necessary orders and to give circulars or necessary letters to the next level officers, the implementing officers, and then we approach these ground level officers for implementation. So these were the main steps that we involved, and after working with the the ground level officials, we develop an SOP for next, further districts. We may have to change certain things for another district. So we work on developing the SOPs. So I'll just share a couple of photos where we have actually worked. Next. Okay, so you can see that we have worked with the DC, where it's very essential that we have these high-level officials on board. Else, I think even the low-level officials will not, they will not agree or accept to implement this. And of course, this is followed by sensitization of these key officials. Like you can see police officers being trained. And just above that photo, you can see that police officials. This is one of the circle inspectors who took the initiative and came to implement the COTPA. I mean, despite having so much of the schedule, so much of work, he took some time out and he came to support the COTPA implementation drive in KGF district. Okay, so next is the TOFI campaign, which is more the school level approach that we are using for this TOFI campaign. And like how Ashima madam told about the approach at the state level, we work more at the school level or at the district level. So basically, we had chosen Tumkur for this campaign, and we regularly engage with the district administration, including DCSP, the DCSP, ZPCO, DSO, all these people. And at the block level, we also engaged with the BEOs and BRCs. They are very important officers in the block level. So after this project, after this campaign, we were able to reach nearly 1,000 officials. In the sense, we were able to train and sensitize them on TOFI campaign and their role in implementing and sustaining the campaign. And we were able to reach nearly 4,000 students directly. This is more physical reach is what we are trying to say. The 4,000 students were directly reached through interactive sessions and quiz. We used to conduct quiz. We asked them questions on their knowledge perception about tobacco consumption and COTPA Act in general. And we work closely with the headmasters and teachers. As per TOFI campaign, it is mandated that they are supposed to put up signage boards. They are supposed to form a school level committee. They are supposed to do awareness. There are so many steps to be followed. So we work very closely with these headmasters and these teachers to ensure that these activities are followed and they're sustained. Not just it's a one-time work and it's done. We ensure that it is sustained for a longer duration, more precisely for forever. And yes, we also definitely we engage directly with the DTCC, the District Tobacco Control Cell, which is a very key agency in the district for tobacco control. And with their help, we used to we conduct enforcement drive only. We do enforcement drive only if it is absolutely necessary. In the sense, if the person is very reluctant to take out the violation, if he's selling tobacco near the school, despite warning him multiple times, then we use the enforcement drive option. Next. Okay, some of the photos you can see our meetings with the district level officials, the school program, the training of officials from RDPR department. Next. Okay. Achievements, I don't know if it is right word, but I thought these are certainly achievements because I'm not sure if any other state has done this. So we are able to have all the 30 districts implement and report COTPA regularly. Even till date, we are having all the 30 districts, both revenue as well as the police districts report COTPA. And we also have COTPA reach the last level of the administration, that is the PDOs. The Gram Panchayat is the last administrative setup of the government. So we have ensured, we have worked towards ensuring that COTPA is implemented even at that level. And we have worked with 30 district with 24 district administration to ensure COTPA compliance initiative. I think one place where we feel proud is that we have been able to make the tobacco control as one of the priority topics for all the departments: health, police, education, excise, and urban development also. And strong reporting. It is also possible because of the NIC and RDPR, orders, as well as definitely strong support from the high power committee. Else this would not have been possible. Next. Yeah. So learnings, as I think Binoy was saying, we need to be, readily available, accessible, and flexible to everybody in the government departments. I mean, they also look at the reliability and the trust, and fortunately, almost over the last decade, we have been able to build that credibility with the government officials at all levels. We are also engaging with the relevant stakeholders, and we are working on sustainable and replicable systems. Like for example, sustainable NIC reporting is a sustainable system, RDPR is a sustainable system, and it can be easily replicated as well. So these are certain learnings that we have come across. Yeah, thank you so much. Any questions? Glad to take.
Thank you so much, Achyuta, for giving a very comprehensive on-ground experience of implementing the TOFI project in Karnataka and also COTPA compliance in the state. We now open the floor to question, answers, and comments, and we now invite the participants to either use the chat box or they can raise their hand and unmute if they would like to ask any questions or comments to the speakers. Pragati has a question on the chat box. We heard the role of champions have played in your work. I was wondering, have you had any instances where the key officials by designation are not taking on the issue of tobacco control, especially those who are in power? How do you manage those and turn them around? Pragati, you'd like to come in?
Yeah, thanks, Vivek, and thanks, everyone. So when, you have champions, you can see the sort of positive impact and the way things progress. But there would also definitely be instances where these key positions or officials are not taking on the issue. And how does that derail efforts, or how do you manage to, go about that? So if any one of you would like to take that.
Thanks, Pragati, for bringing out this important thing. And yes, of course, definitely, you're right. Many times what happened is that while we are, pursuing for our cause, and many times it's not that, every stakeholders or every policy maker will be on our side, whether in any ministry, I would say pursue. So we try to do that, as much as we can be able to do that, but many times we are not able to crack that also. So in that process, what we try to do that maybe, X person, like for example, this X person, we tried our best, meeting, sensitizing, providing everything, but despite that also not able to come on our side. So what we try to do that maybe the other, any other, I would say the other, a person who is connected to that person, maybe like, for example, somebody in the health, or say, for example, in the finance, somebody is there and that policy maker has not been helping us or not been doing that. So what we try, we go to the other way, maybe from the health, some official know that person and try to say that, yes, you should do it, why it is important. So that approach, we try to sometimes do that. And yes, maybe sometimes we succeed, sometimes we don't also. So that is how we are learning is that. And many times also we try to invest a lot of time also in, trying to get that person on our side, but many times it don't happen. So we rather go to the other representative who can help us in our issue.
Sure. Thanks, Binoy.
Thanks, Binoy. Kranti has raised her hand. Kranti, you can come in.
Thanks, Vivek.
Yeah.
It's nice to see all the things that the CSOs have achieved. I'm interested to know if you can quote any examples of collaborative action that has led to any laws or policies, especially with respect to tobacco industry interference in public health. If any of you would like to take that up, probably especially involving media and public health researchers and healthcare professionals. If any examples one of you can help me with, that will be great and encouraging also.
Thank you for taking it up. Very important thing again. So yes, definitely. So one of the the case study that I would like to share is that this was pictorial health warnings. One is this thing whereby as you know, in 2009. India brought up with the pictorial health warnings that was there only on one side of the packet with 40%. And that picture was not at all gory. And as you know, that pictorial health warnings is one of the medium to educate the people and also reaching out to the illiterate to how that product which they are using is harmful. So in 2014, when the new health minister came, Dr. Harshvardhan, so that time, we as a civil society group, all the civil society mainly went to the minister, requested him that, the India should implement larger health warnings because it is very important. And as per the law, as per Section 7, it clearly mandates that. And we, in fact, as a civil society, we requested him that, our neighboring countries like, Sri Lanka, Nepal, they've been having a larger size. Like India was having just 40%. We quoted them. They were having it like Thailand. They were having 85% pictorial health warning on both sides of that. So the health Dr. Harshvardhan was really as a doctor and also to be he was a champion. And due to the constant efforts of everyone, have been educated and sensitized them. So he then immediately gave this thing direction that, we requested actually to be very honest, we requested for 60%, but he just went, why not we should have 85% because our neighboring country, Thailand is having 85%, why should not? So India, then Ministry of Health came out with this notification. So suddenly then, the government, like, as you said that about the industry interference, tobacco industry has come out like really in a big way and then start troubling and, putting all the pressure on the government to take back this thing, and they should not implement this pictorial health warnings as this will affect. So they tried all this, and due to the constant pressure from the industry and all, so the government, the Ministry of Health, roll back this notification. And thereafter, in 2015, then thereafter, a campaign was started on whereby different civil society organization, not only civil society, there were different voices came out together collaboratively. There were also cases which was being, filed in the courts. Also in the Karnataka, the industry went to the court, and lot of legal hurdles were being there, and lot of pressure were being put up this, and due to which there was this constant pressure not only from national but also from globally also. So this actually created a huge pressure on the government, and media has covered extensively this pictorial health warnings. In fact, due to the pressure, this became a national debate whereby very prominent news channels like NDTV, CNN, there were news debate like where being various spokespersons were being invited, not only from the civil society, MPs were being there, different industries. So there were a lot of pressure on the government. So due to which, what happened in 2016, ministry has to come up again with that. Then they said we will implement the pictorial health warning. So this is one of the very successful, I would say, very successful campaign where there, due to the collaboration of everyone, doctors, civil societies, youth organization, women organization, everyone was being part of this campaign, and due to which now India has 85% pictorial health warnings along with the quit line number on tobacco products. products. So this was one of the case study will be there, and media has actually, of course, media has really done a really good work in this front. The other case study was on the ban of gutka. Again, in 2012, when Food Safety Standard Authority of India came out with a notification 2.3.4, where they said any food product which contains tobacco and nicotine should be banned. So thereafter, then the campaign started on there. Again, all the civil society organizations across all the states came together. There was this, as Dr. Ashima has shared about the voice of tobacco. This voice of tobacco victims has actually played again a vital role in it, and urging. So this whole campaign also went on, whereby different people from different sectors have come together and to get gutka banned. And so again, this was also another important case study which we have seen, and media again have covered this issue as well.
Thanks, Binoy. Amir and Aarti's hands are raised up. Before that, we'd like you to know that we've crossed 4 p.m. We'll be taking just a brief question answers for another 5 minutes. So yes, Amir and Aarti, you can unmute and yeah.
Yeah, adding to that, sir, I would also like to share one of the case study, e-cigarette campaign. Like during that e-cigarette campaigns, we faced hurdle in like passing that banning on that e-cigarette from that government and that court. But sir, we also have like the take the support from the NSS, National Services Scheme. We have got huge support on that. Approx 5,000, more than 5,000, I can say that the NSS volunteers who have joined for that e-cigarette campaign ban support with us, and also 1,000 doctors, VOTV, with support of VOTV channel. VOTV doctors also supported that that campaign on banning e-cigarette campaign. So as sir had told, we all have to work together on the different subjects, and e-cigarette is a successful campaign. We have that achieved and ban on that e-cigarettes in that period in 2009, and later in September 2019, that's a resolution passed on banning on e-cigarette in India also. That's a huge success for all of us also. So that's it from my side.
Thanks, Amir. Kranti, would you like to ask another question, or has it been answered?
If it's okay, just the last question.
Yeah.
I'm also curious about the whole indirect advertisement of pan masala, which again they claim that there is no tobacco in it, but it seems to be a tactic for indirect advertisement of tobacco products. So it's majorly, it's very loud, it's all over the place, it's all over cricket or sports channels, all over cricket stadiums, and on the TV, on buses, billboards, everywhere. Is that I mean, I feel like it's something that's a big concern. How is it being addressed, if it is being addressed, or how can it be addressed?
So yeah, thanks, Kranti. So basically, yes, this is very a very major issue which which everyone has been working on as a civil society as a whole, at a national and also at the state level. Also, there has been concern because there has been huge, as you rightly said, there is rampant violations. This advertising, like you can see renowned Bollywood actors like Ajay Devgan, and also Ranveer Singh, and many others, Shah Rukh Khan, so there is actually a loophole, like, in the law that, they are actually saying that, the pan masala contains 0% tobacco, 0% nicotine. So under that, they have been doing it. And in fact, we had actually reported this kind of violations to the Advertising Council of India, and whereby we have strictly said that yes, of course, these are again violation, and that needs to be stopped. And we have seen many things during, as you said, during the different tournaments, matches, and all that have been, you can see different ads like Shikar and Pan Bahar, and all that has been displayed. But yes, this is one of the area where we have to work, and we need to focus on this thing because they have been using it. And recently, if you remember, have you seen recently they actually approached, the smokeless industry has actually approached Amitabh Bachchan also, and while they gave us again this thing to him that this is just a flavor product, does not have any nicotine and tobacco. But later on, when when as a civil society groups, when they have start writing to Amitabh Bachchan that that he should not promote because this is going a wrong message to the youth and also to the country, because he's a public figure and he should not do that. So later on, when he realized that, yes, of course, he was not aware because if he was being given this impression, this is a flavored product. But then Amitabh Bachchan withdraw that, ad. But now also we are noticing in Delhi, we are seeing still now there are some banners and all that which we've been doing. So yes, of course, we all have to work towards it. And definitely we need to bring out to the Ministry of Health notice that how this can be tackled.
Thanks, Binoy and Kranti for your question. I had one final one, is that one of the commonalities across the three different sort of presentations and the different ways in which NGOs or civil society organizations implement tobacco control is on the strong emphasis on changing public opinion in favor of tobacco control through various means. And we've been seeing that in the case of media through press releases and several other sort of media excerpts that Bina has been has talked about. I wanted to know, especially in the TOFI project in Karnataka and other parts, how easy or difficult it is to change public opinion or opinion of school-going children and students, since Ajuta and Amir and Aarti have been closely working in schools and educational universities. What are the challenges and how do you ensure that such a program at a very micro level can achieve sustainability? Or if anyone would like to answer that, and then we can close the webinar. Yeah.
Hi, Vivek. Sorry, I don't know, some issues in the phone, so I'm just using this ID. So I think one understanding or one of the experiences that I have come across when we bring children in the picture for tobacco control, we don't see too much of a hurdle in terms of implementation or in terms of training or whatever it could be that we are approaching the officials for. If we are bringing the picture of children, we definitely don't have any kind of issue in implementing it. So that has been one of the I would say a positive feedback from all the officials. So yeah, I mean, TOFI campaign definitely gets support all the time.
Thanks, Achuta.
I just want to add as what Achuta has said. Yes, rightly he said that we need to actually yes, of course we are working, but we need to take it in a larger way. We need to create this youth champions in terms like as Sambandh has rightly they've been doing really good work by involving this NSS. Similarly, we need, along with the college students or the school students, we need to have some eminent sports personalities as well. And it should not be a one-time arrangement. I would again say it should not be that for a specific. We need to keep a regular engagement with them. And in fact, we need to have this, these champions ready from across all this thing. Like, different, youth champions from different states, if they are coming up, together, they've been raising up the voices, that would definitely make a huge difference. And again, the social media, all this, the youngsters now being there on the social medias, and we have seen, all the government people, in fact, different policy makers are being there. So if we can create one group, like a youth voice from across this thing, this will definitely make a huge difference. Thank you.
Thanks, Binoy and Achuta. I think if there are no questions or comments, we can close the webinar. So
in addition to what Binoy and Achyuta have mentioned, we would like to also mention something that in TOEFL program, the principal and the teachers, only principal and the teachers can implement TOEFL in schools. And it is very important to ensure that they take leadership and ownership of the entire program. Because only the principal and the headmasters can do on-ground activities in TOEFL. As mentioned in our presentation, we have got more than 1.9 lakh schools active in TOEFL, and more than 4.7 lakh on-ground activities have been conducted under TOEFL program so far. Education department is one of the largest departments in government, and moving education is like moving an elephant. So, and BOTV has really helped us in getting the things done. And as you mentioned in the question about the challenges, see, we have been working in 4 different states. And as per our experience, every state has its own challenge. Like if we compare Karnataka to UP, the teachers in Karnataka are more gadget friendly as compared to the teachers in Uttar Pradesh. If we talk about the northeastern state, Meghalaya, in Meghalaya, there is a network connectivity issue. So the challenges in implementation of the program, it differs from state to state. And on our part, how we take up these challenges, we have created a mobile-friendly app, which is actually state-wise app, and it is a web-based app which can be used on any device like smartphone, computers, and it is user-friendly and very convenient for the end user. Thank you.
Thanks, Aarti, for your really insightful comments on the contextual factors that really influence the implementation and how that is different across different states. In fact, that is similar to what we are also trying to study. The fact that tobacco control laws are universal, but implementation is different in different states because of several contextual factors. So I think on this note, I'd like to, on behalf of the Anusthana team at IPH, I'd like to thank all of the speakers here today, Dr. Ashima Sareen and her representatives, Amir and Aarti, Mr. Binoy and Mr. Achyuta for their time and also sharing their experience in implementing tobacco control policies at the national and local level. I also would like to thank all of the participants who attended this webinar, and any information on the kind of work we do at Anusthana or IPH in general in the domain of public health, you can go to the IPH website, iphindia.org, and you can also follow us on our different social media channels. Thank you so much to everyone, and we'll see you for the next Inside Implementation episode.